The National AIDS and STIs Control Program, NASCP, of the Federal Ministry of Health has reaffirmed its commitment to eliminating mother-to-child transmission of HIV and improving pediatric treatment coverage in Nigeria. This was at the National HIV Health Sector Symposium held in Abuja with the theme Advancing PMT-CT and Pediatric Treatment Coverage in Nigeria. First Lady Oluremi Tinubu was represented by the Ministry of Women Affairs and Social Development. The National Coordinator of NASCP, Dr. Adebobola Bashun, emphasized the need to close the treatment gap among children living with HIV and to strengthen preventive efforts, particularly the prevention of mother-to-child transmission.
And sadly, our women and children and the vulnerable groups are the most affected, and these are the people that we serve. Many babies born with HIV-positive mothers are not tested early enough, mostly because their mothers are unaware and uninformed about the risk. Our goal should be to ensure that no child is born with HIV and no mother is left behind in accessing treatment. Nigeria has made commendable progress as more women are getting tested during pregnancy and are accessing treatment. But major gaps still remain. 1 in every 5 children born with HIV globally is a Nigerian.
In the past, Nigeria has been reported as not doing well in a lot of areas. So in the last 2-3 years, the government took it upon itself to go beyond boundaries, create changes, and get results. So this symposium is to show people where we are, to have our own narrative as a people, to say the government has done so with its partners and been able to do more, and these are the results. So
Development partners pledged continued technical and financial support to Nigeria's HIV response, stressing the importance of integrating PMT-CT into maternal and child health services.
With the government to be able to strengthen everything pertinent to PMT-CT and pediatrics HIV response. So our role here is to support and amplify the effort of NASCP.
Is now tasked with ensuring the continuity of former USAID programs, which are now integrated within the Department of State.
Long way, we've gained some progress, and now it's for us to consolidate on the progress, to sustain the gains, to ensure that we continue to improve on the narratives and to improve on the statistics. And we have to do this together as a country. We have to ensure sustainability, ownership as a country. We should reduce our reliance on external donors, but rather as Nigerians, for Nigeria, we should develop.
Basi Taikman reports that participants called for renewed political commitments, increased funding, and intensified awareness to ensure no child is born with HIV and those living with the virus have access to life-saving treatment. As Nigeria works towards achieving the 95-95-95 UNAIDS targets by 2030, they stress that closing the gap in pediatric HIV services is not only a public health priority, but also a moral imperative. The